Hi everyone, I'm Dr. Bishr. Welcome back. I am a board certified dermatologist and Mohs micrographic surgeon, and I have a special guest today.
Hi, I'm Bria Barjuca. I'm a nurse practitioner in dermatology.
Today we're going to talk about melanoma since it's Melanoma Awareness Month. This is May, and we're approaching the nice sunny months, so we wanted to talk a little bit about it, give you some facts, have you look for suspicious moles on your body, make sure that you see the dermatologist if you need to, but all in all, just sharing some knowledge with you.
So I always tell my patients, melanoma is something that can happen to anyone. The most common location for men is where?
Your back.
And the most common location for women is on the back of the calf. So I think that kind of takes people off a little bit. And then what you want to look for is any change in any mole. So the most common moles to turn into melanoma are the flat brown moles. They have 1 in 5,000 chance of sometime in your life turning into melanoma. So I think people kind of overlook those and think those are freckles, but they're actually moles.
You can get moles turning bad, and you can also get melanoma starting de novo. In fact, most melanomas do start de novo, meaning they just arise. So if there's a mole that you didn't realize was there before, and all of a sudden it's new, it could be a melanoma. Not all of them are melanomas though, because you can continue to get moles as you grow.
35 to 40, typically you stop making as many moles. I tell my patients if you start making new moles after 35 to 40, you need to let me know. And they should always start like a pinpoint. They should never be, large and growing rapidly. The moles you have should never change. So, they can grow with you. So as women, if you were to get pregnant, it could grow with you, but it shouldn't grow faster than you. And same thing if you were to gain weight, that kind of thing. Also, losing of color is something I think people don't think of, but that's called regression, and regression can be a sign of melanoma as well.
Yeah, you can also have halo nevi, which the body attacks the mole, and the mole loses its pigment, and you have like a halo of depigmentation around it. You can have halo nevi in kids, but you can also have them as a sign of melanoma. But back to the basics. People think melanoma doesn't happen to them. How many melanomas a day or a week do you see in your practice?
So my path I get back, I would say it ranges anywhere from 3 to 10 a week. Getting your skin checks is crucial, especially I just think people don't know what to look for. And also you can't see most of your body, right? You can't see 50% of your body, you can't see your back. And we just said the back and your calves are the #1 location for melanoma. So having somebody look at that for you and be able to actually look at the pattern of the mole to decide if that needs to be taken off is really important. Are melanomas always brown?
No, they can be amelanotic, meaning melanoma without melanin. That doesn't really make a lot of sense if you think about it, but they can lose their melanin, so they can be pink or skin colored, and they can be as dangerous.
Yeah, so I actually have had a few people who came in thinking they had a wart, and it ended up being that type of melanoma.
That's crazy. So they thought it was a wart. How did they treat it?
Yeah, so they were actually spraying it with like liquid nitrogen and stuff.
Oh man, yeah, that's not good. It is deadly. Most of the time, if we catch it very early, it's curable. If the cat's out of the bag, it becomes very, very hard. About 8,000 Americans die of melanoma every year. About 1.3 million Americans are living with melanoma currently.
And melanoma can happen anywhere. All because you don't see the sun in a certain place doesn't mean you can't get melanoma. You can get melanoma on your nails, you can get it in your eye, you can get it, on your feet, on your hands, on your butt, you can get it anywhere. So it's not just in sun-exposed areas. There is a slight genetic component to it, depending on, where it's located and who it is. So that, along with certain risk factors, what are some risk factors of melanoma?
Some risk factors are obviously getting burnt, sunburnt, using a tanning bed, having blue eyes, fair complexion,
So I would be more at risk than him, for instance.
Yes. But I still have to be careful. Just because I have pigment, it doesn't mean I won't have a melanoma. Just because I'm African American or I'm dark skinned, it doesn't mean that I won't get a melanoma.
So where are the most locations common for like skin types 3 through 6?
Your extremities, acral melanomas can happen. Nail melanomas can happen in anyone. You can have, like she said, melanoma in your eye. You can even have it in your lymph node. In fact, 20% of melanomas, we don't know where they start. So they're just they show up as metastatic, which is pretty scary. So it's not just a skin cancer, it's not just a mole. It's very important that you look at the ABCDs of melanoma. A being asymmetric, moles that don't look the same on both sides are prone to be atypical, or melanoma. B's border irregularity. So if the border is jagged or it's irregular. C's color change, we mentioned that.
We kind of talked on that with regression, either loss of color or gain of color.
Or multiple colors, or it looks very dark. In D's diameter, if it's bigger than a pencil eraser, it's not good. Now, not all big moles are bad, but it's more likely to be atypical. And E is evolution, so if it starts to change. So if you had a mole that's bland and all of a sudden it's changing, you should get it checked out. What age is the youngest patient you've had with melanoma?
16.
That's very young. Mine was 19, and it was a deep melanoma on her back. So it can happen with anyone. It's more likely to happen as we get older. So it's very important to get your skin screened and checked.
So with that being said, get your annual skin checks with your dermatology provider.
Yes. Don't forget to like and subscribe, and ask us any questions you have in the comments. Thank you.